Someone in my office read the article and they're like, this is ridiculous. We just had 3 dancers here in the past 2 weeks. Professional level dancers and athletes, there's a culture to wanting to be a little bit tough and tough it out and tough through injuries.
Our guest today is Dr. Damon Noto. He's an award-winning physician who treats a range of athletes, football players, figure skaters, and Shen Yun dancers. What injuries did these dancers get? What medical treatment did they receive? And how does it compare to professional sports? We talk about that and more on Shen Yun Voices. Damon, it's good to see you.
Good to see you as well.
Damon, what do you do?
So I'm a physician. I'm a medical doctor, and most of my practice is around sports injuries, rehabilitation, so people get into sports injuries, car accidents. Usually we call it musculoskeletal problems, so joints, tendons, muscles, ligaments.
How long have you been practicing?
I've been practicing since 2005, so a long time.
Yeah.
Yeah.
Where did you go to school?
I went to Mount Sinai for medical school. Then I went to Cornell, Columbia for my residency. And then I went up to Boston at a place called New England Baptist for my fellowship. Yeah, so.
I saw on your CV there, on your online CV, that you have all kinds of awards, right?
A couple, yeah.
There's
had a couple.
top 10 doctors in the metro area, is that right?
Well, that was 1 year, yeah. But
still, there's a top 10 doctors in the area, in your field, is that how it is? Or?
yeah, a lot of that could be either from patient voting, or they tally up how many, good reviews you've had, or so, yeah.
I noticed there was one that was the On Time Award. What's that one?
So physicians are notorious for being late, and when you go to the doctor, 30 minutes, 45 minutes before you're actually seen. But in my practice, we try to keep it to 10 minutes or below. So I guess we stood out in our field that we actually see our patients close to their appointment time. So we try to be a stickler for that.
What has been your experience working with Shen Yun performers? How did you first start working with them?
I had gotten called. I knew one of the company managers, and they had said, oh, we had one of the dancers got hurt. Would you be able to take a look and evaluate them? I said, sure. And after that first dancer, I think they got comfortable with me. And from there, it kind of just built over time, where if a company manager knew me, they would say, hey, Dr. Noto, we have a patient, we have a dancer that hurt themselves, can you see them? And over the years, it just progressed. It just grew naturally.
Is it common in sports or in performing arts for like the company manager to call you rather than the performer or the athlete?
Absolutely. Usually it will come from a manager or the teams or the dancers, sports director, or is somebody in the company that kind of manages that. Is usually almost never from either the athlete or the performer. It's usually arranged for them. They're told, okay, your office visit's at this time, you're gonna get imaging at this time, and then we coordinate with them. So for instance, if it's a bad injury like a fall or something and they need an x-ray, we might coordinate through the company manager. Okay, show up at this time without even seeing me. You're gonna go right for an x-ray, then you're gonna come see me. It's usually all arranged and coordinated, and tries to take the load off of the performer or the athlete so they don't have to really think too much about that and just focus on what they need to do.
Okay.
Yeah.
So over the years, how many Shen Yun artists, dancers, musicians would you say you've seen?
Oh, I've seen a lot. I would say every year, especially the past few years, I've been seeing up to 2 or 3 a month. And that just also depends on whether or not they're on tour or not, because when the company goes on tour, I'm seeing less. But when the company is back, it could be 3, 4, 5 a month that I'm seeing, depending on, I see everything from small things like a sprained ankle all the way to a broken bone. All the way to a meniscus tear or Achilles tear. So I'm getting the gamut. Or, they tumbled and they fell the wrong way. Can you just do an exam? It looks like they might have sprained something. Mm-hmm. So I'm seeing a gamut of things from very mild to more severe. So I could see a couple of really small things and then maybe one significant thing in a month. Yeah.
Have you worked with other companies or other performing arts?
I work with a lot of athletic teams, yes. So I've done other musicians and other performers, but in terms of companies, Shen Yun is the only company, but I've worked with a lot of athletic teams.
What about others similar, like maybe gymnasts or?
Yep, I've worked with ice skaters, gymnasts, track athletes, other dancers, musicians.
Cheerleaders?
Cheerleaders, yes. I had the New Jersey Nets cheerleaders for a little bit.
Oh, wow.
Yeah.
Okay.
So when I first came out, my boss was one of the team doctors for the New Jersey Nets, and we also had the cheerleaders. So we had both the players and the cheerleaders.
Oh, wow.
Yeah. Yep.
That sounds pretty interesting. Get to know a range of people.
You do, and there's all different types of injuries depending on what the sport is or what their athletic thing is. So like cheerleading, they do a lot of tumbling, just like Shen Yun does a lot of tumbling. So those type of traumas, you're seeing different things than maybe, let's say, a soccer player.
Yeah.
Yeah.
So how comparable are the injuries that Shen Yun dancers experience, dancers especially, compared to these other professions?
Pretty comparable, actually. The injuries that we see with athletes and what we see with the performers and dancers, they're close because of, I think, the tumbling aspect of the dance that Shen Yun performs, as well as the technical difficulty, and I would say the high-level techniques that they're doing. We're seeing very similar injuries to gymnasts, very similar to something like very competitive cheerleading. Those very common. Mm-hmm. Yeah.
What are the main ones, would you say?
Well, we see everything from ankle injuries, such as Achilles tears, to sprained ankles, broken bones, a lot of knee injuries in terms of meniscal tears, tendon tears, hip injuries, labral tears. We see the gamut. Shoulder injuries, fingers, right? You're putting your hands down, things happen, a lot of hands and wrists.
Yep.
Yeah. I mean, we pretty much see it all. When you fall and you hurt yourself, and especially in practice, they're trying new techniques, the injuries can vary. Yeah.
What about more chronic things, like, for example, for violinists, shoulders, things like that?
Exactly. Shoulders is very common for the violinists. Elbows, hand and wrists, that's much more common. Some of the dancers' hips would be more of a chronic thing, especially with a lot of tumbling. Mm-hmm. They tend to develop some chronic hip pain. So, and the feet, like let's take ballet dancers, your feet take a lot of toll on your feet, depending on your style. And Shen Yun is interesting in that it does a lot of the traditional Chinese, but it also mixes in more of a classical Chinese dance, which they're using their feet and ankles a lot, which means that they have a higher risk of developing some type of foot injury.
Is there any difference, would you say, between the Shen Yun artists that you see in terms of their approach to the medical care and the other athletes or performers?
No, I think it's very professional with Shen Yun, just like in the other organizations. The company manager actually stays on top of it very closely. They usually try to call me as soon as something happens, get on top of it, jump on it as soon as possible. And it's kind of typical that the professional level dancers and athletes, there's a culture to wanting to be a little bit tough and tough it out and tough through injuries. So they want to kind of like push the limits. So we see that a lot. So we like to do imaging and things to say, hey, this is something you can push, or this is something we need to rest. And the company managers are really good. They have to work with the dancers to say, no, we got to wait a little bit longer before you're back out there. But I would say it's pretty similar. Company managers are really on the ball usually with the dancers, I find, and stay on top of their care from beginning to end. So that really makes a big difference. Yeah.
Is it similar to how, let's say in baseball, the starting pitcher does not want to come out of the game, the manager's got to pull him off? Is it similar with the dancers? You really need the managers to come in and say,
100%.
You know what?
100%, because they want to perform. They want to be out there. It's painful to sit on the sideline. It's painful to not be in the show or in the performance, and they would like to do as much as they can, especially when they're at a certain level and then they get an injury and it brings them down. They want to get back there as soon as possible. So we look at the safety risk and also the time to fully heal so that it's safe for them to go back to fully. And I would say Shen Yun does a very good job about that, especially in the off season. We try to make sure that they get ready for the tour. And I think their training and the way they make sure from flexibility standpoint, strength standpoint, endurance, that they really focus on that to minimize injuries. All in all, I would say Shen Yun probably has a lower rate of injury than I'd say some of the other athletic teams.
Why do you think that is?
I think it's probably the training. Their training is very rigorous, and it's comprehensive. But I think going into the tour, most of the performers are really ready. So while other ones with athletics, you have new people coming on, coaches are trying to push the limits with some of the players, see how much they can get out of them, and injuries can be pretty high. Yeah.
Have you ever seen anything in terms of performers in Shen Yun being discouraged from getting treatment or being sent back to the stage too soon?
No.
Are you involved at all with their rehab process?
Oh, yeah, definitely. And if anything, I would say the dancer is the one who's trying to get back on, and the company manager or the company itself is saying, whoa, let's wait. Let's make sure that everything is good before we start pushing it or get you back on the show. So, no, very cooperative, and I've never seen any, resistance. I've seen many go on to have surgery, and a lot of the dancers and performers are scared. It's surgery. Some of them are younger. You're in your young 20s, surgery can be scary, but, I think the company manager tried to talk them through and say, hey, this is what we need, and this is what you need to get better, and eventually, if you want to perform, we really need to think about that surgery, and they're very supportive from the beginning to the end, yeah. Now, I've interacted with a lot of dancers, their family members, so many have come to my office, and usually the family's very supportive, and they're saying, well, what is, either my brother, sister, or son, daughter, or what do they need to do to get better? And, some of them play an active role in it.
It sounds like you've interacted with quite a few of the parents as well.
Oh, yeah.
What would you say to parents whose kids are thinking about a career in dance or taking it seriously, going to a boarding school and studying it?
I would say if that's what your child wants to do, and that's what your child has a passion for, support it 100%. But no, it is very rigorous. It's like any other, when you're trying to get to a professional level in athletics or anything, it's difficult. It's hard. You're putting a lot of heart and soul, hard work in it. You're studying at the same time a lot of times. It's not an easy path, but it's a very, I think, rewarding path. And when I've seen some of the performers, they've invited me to come watch, and when you see them on the stage, it's amazing. So I would say, if that's what their passion is, support it. But no, it's not necessarily the easiest road.
Did you read some of the recent critique in the media of people saying, Shen Yun performers are forbidden from getting medical care or discouraged to get medical care?
It's funny is because my office, someone in my office read the article and they're like, this is ridiculous. We just had 3 dancers here in the past 2 weeks. What kind of story is this? So it was very funny for us. It's like, it's so far from the truth. So yeah, I've heard about the article, but I think it's nonsense because I can tell you already, since the tour stopped, how many dancers I've seen from minor injuries to major injuries. And who's getting x-rays, who's getting MRIs. We have a steady flow. I would say, every month we're getting a few x-rays. Every month we're doing a couple MRIs. So they're getting steady medical care, medical treatment. That article is pretty shocking to me that they would make those statements.
Yeah. How did you, as a doctor who's seeing them, how did you personally feel about it?
It's a little insulting because I know how many I've treated and how many I've seen go through the process of rehab or surgery. And it's a big deal when you have an injury and you have to put your heart and soul in getting back to performing. And to say that the Shen Yun company hasn't been supportive of some of these dancers. If anything, I've seen tremendous amount of support for them to try to get back to 100%. And it's kind of insulting to see to the dancer, to the people who have helped in the medical care, like, all the doctors I've known or referred people to, what they've done to try to get them back, it's disappointing, yeah. So I don't know what kind of investigation they did, but they obviously didn't talk to many people because I've known so many physicians that have treated Shen Yun performers.
Have you ever encountered anything similar to what Shen Yun has faced with people saying, oh, they're not getting medical treatment, let's say from sports teams? Have you ever seen this kind of critique?
I haven't really seen as anything like this, where there was just a direct, attack on a company for lack of medical care. And it's kind of shocking to me because how would they know how much medical care they get or how many people are seeing physicians? And so I feel it's a little outrageous that they would say they understand what's going on with a whole team or a whole company. Yeah.
Yeah. What do you make of it? Why is there such a narrative when you're seeing these people on a regular basis that it's not just that the claim is not that they're being put back on stage too soon. The claim is that they're being discouraged from getting medical care in the first place.
To me, it makes no sense at all why you would say that when you have so many performers getting treated and medical care. So I don't have a good reason, but it seems to me that someone had something out for them, for the company.
And did anybody call you? Anybody ask you? I mean, you're one of the main doctors
No.
that sees Shen Yun performers.
No.
Anybody could have said that.
No one ever reached out to me. So it's surprising to me. Yeah, and again, my staff, when they saw this article, was laughing. They're like, what? This is ridiculous. So they were asking me, what is this about? And I was taken back by it, to be honest. Yeah, so... I don't have a good reason why they would do that, to be honest.
How many people in your office interact with the Shen Yun performers?
So my office has 1 or 2 medical assistants. We have 1 nurse. We have a couple medical receptionists. We also have staff like X-ray technicians that come in. Those are the ones typically in my clinic who are interacting with them. But then when we send them over to different types of imaging places, so there'll be radiologists, other medical staff that will assist them in getting their MRIs done or X-rays done. There's also medical centers we typically refer them to that have full staff of doctors and nurses. But my clinic is usually me as a physician, a nurse, and a couple medical assistants that are seeing them.
What are some of your colleagues, what professions are they in medically that you've seen them help Shen Yun
Most of
performers?
them are orthopedics. So I have orthopedic friends who do knees, hips, foot, ankle, physical therapists, the gamut, hand therapists, occupational therapists, the whole gamut, yeah. I mean, there's been other instances where I know they had a trauma, but they also had other things like their eye or something scratched, so we had to send to an ophthalmologist or other specialists. But most of my care has been in the orthopedic realm, yeah.
What's been your impression of the character of some of the performers that you see? Like, They're
great. These really... First of all, they're sweetheart people. They're really nice. They're very respectful to the staff and to the physician. And I think they're there to get better. And they're there to say, honestly, like, what do I need to do to heal and get back on the stage? And I find them to be similar to other athletes in that they want to heal as fast as possible. They want to get back as fast as possible. But they're also understanding, like when we say, no, you're going to have to wait 4 weeks, 6 weeks, and they're good. They're really good, yeah.
Have you ever had a chance to see a performer who you helped heal perform on stage?
I have, and it's really rewarding to see that. It's just, I'm thankful I can even play a part in it. Yeah, whether that's just supporting them and getting back to where they were or just giving them reassurance that, hey, this is not a bad injury, you're going to recover.
Is there more, do you think, dancers and musicians can do in terms of preparing themselves physically and for a long career?
Yeah, I think for me, the preparation that goes into a tour is very important. They want to go into the best shape they possibly can, flexibility-wise, strength-wise, endurance-wise. And know if you're in for the long haul, it's not only about like, can I do the best jump right now? You're thinking about over the next 10 years, my tumbling, my athletic ability, if I think more in long term instead of just a short term, is probably better because you might have a great performance, but what's the grade if you only get to perform 1 year because you overdid it and your knee is blown, right? So I would say the preparation is really key. You want to go into a season, whether that's soccer, football, whatever, in the best shape you possibly can. Mentally, physically, everything. Yeah.
What would you say are some of the differences between athletic performers and dancers or musicians in terms of how they approach their healthcare?
I would say there's a little bit more unity among performers and dancers as more of, even though they're team sports, a lot of times within the sport, they're a little bit more competitive with each other. But that drive to want to perform at a high level, I would say, is similar. So that's tough. And that culture of wanting to be the best, I see that in performers, dancers, athletes, and there is a strength to that. Their drive is amazing. And they push through a lot. They push through pain, they push through injuries. I see similarities there because they're wanting to be in the performance. They wanted to be, with the team and performing on stage. So that's tough. And that culture in that world is probably similar. Yeah.
Have you had any encounters with Shen Yun performers who pushed through something and it was much later that they were actually brought to you?
No, I haven't experienced that, but I have had some performers who've had some chronic injuries. So on and off, they had this, my ankle hurts from time to time. And then finally got to the point where I have swelling now that won't go down, which is common in the athletic world. So sprains and strains are common, you get them. But over time, if they keep coming and going, then they're going to get to the point where it's now it's a chronic injury. Now we really need to evaluate it.
Yeah.
So we see that. But from what I can see most of the time, and I only see a portion of the performers. I don't see all the performers. I know some of the company managers, and there's other doctors that treat other performers. But from what I've seen from the company managers, they stay on top of them pretty closely. And when they notice something is off, they let me know right away. They jump on it right away. Say, can we get some imaging? Can you evaluate them? So I would say they're pretty on the ball with that.
How do they differentiate between an actual issue or just, okay, I need to take it a little easy, there's some fatigue here, maybe I landed awkward? How do they tell the difference?
So it's usually two ways. One is that the pain becomes to the point where it doesn't go away. So, aches, pains, and things is common, athletic world, dancing world. But usually it comes and goes. So, a couple of performances that hurt, and then it went away. But then there becomes a pain that's there every day. And then it's in their daily life. Even if I just walk to get something, I have pains, something is off. The other is when it starts to affect their abilities. So I used to be able to jump and do this backflip. Now I can barely pull it off because I don't have the oomph, the strength that I have. And then they know something is up. So it's usually either affecting their performance or it's a pain they just can't shake. So that's usually what happens, yeah.
Is the physical therapy something that they do with you guys, or they get guys to go back on their own?
Depends on the severity of the injury. When it's severe and they need surgery, physical therapy is done usually outside, and it's usually at a facility. If it's a mild injury, we usually do a few sessions with a physical therapist, and then they're doing a lot of the rehab on their own, and then they're checking in with us saying, how are we doing, and we'll evaluate them. But if someone goes on to have surgery, it's usually formal physical therapy at a physical therapy facility. So, yeah.
When you entered medicine, did you anticipate working with performers and athletes? Is that something you wanted to do?
Not when I entered medicine, but when I was getting towards the end of my medical training, that was something I wanted to do. I think when I first came in, I didn't really know exactly what I wanted to do. But as I started to evolve through it and I saw other physicians treating athletes and performers, it's something I really enjoyed. So, and I have more of a little bit of an athletic background, so I was kind of interested to say, okay, how can I help these athletes? I played soccer as a child. I did a lot of martial arts. I was into wrestling. So I was in that world, and I felt that I had that background where I might be able to help other athletes if they get injuries, get back to performing at a high level. Yeah.
When you see them on stage or you see people back on the field, does it make you want to go out there with them?
Oh, 100%. 100%. Makes me think, oh, if I was younger and I had that training, could I do those flips and could I do those jumps that they do and those kicks? 100%. Yeah. I can say I get some jealous sometimes thinking like, ooh, if I had that choice, maybe I would have picked that if I was younger. Yeah, for sure.
You probably would have been pretty good at it.
I don't know, but I probably would have tried.
Somebody else would have been taking care of your injuries. Then.
Exactly. I think the flexibility part would have probably been the toughest part, but it's amazing when you see some of these performers' flexibility. Men, women, they're phenomenal. Yeah.
Well, Damon, thank you so much for everything you've done for the performers and for your continuous work and services for everybody.
My pleasure. Thank you. And thank you for inviting me on the show.
Really good to talk to you.
Good to talk.